Good morning, friends. I wish you all are fine and okay. We are going to continue with our Mch Care services, and all these classes are going to be on the maternal and the child survival. In this particular session, I'm going to speak more about the growth of the child, children's growth. And especially the attention will be given to the growth chart. I think you all have heard about the growth chart. So what is this growth chart? See, as an adult, if I gain the weight, I can speak and say, yes, I have gained 2 kg weight. I can even say I have lost 2 kg weight. All adults, adolescents, elderly people speak about their gain or deteriorating health in their own words. But children are the only people in the human population who don't know anything what is happening with their health. They don't know their height is increasing, their weight is they are losing, or whatever is happening as far as their health status. So somebody else has to do the monitoring of growth of the child. So how that growth of the child should be monitored? It's not so easy, because when I say child means right from the birth till the age of 5, under 5 child, then from under 5 child to the adolescent girls and boys. So it's a very long stretch and the patch, and to keep monitoring the growth. In other words, we speak about the growth as a milestones. Which are those milestones? Milestones are physical milestones, mental milestones, mental development, social milestones, social behavior with the people. So these are various milestones which are related to the child development in the group. So now I will come to it. So which are those standards? How you are going to do it? When we take the weight, kg is the standard. When we take the height, it is the centimeter, feet is the standard. When we are taking overall growth of the child, what should be the standard? There are many scientists, pediatricians, social scientists, medical scientists. Everybody has developed different indicators in monitoring of the child growth. But remember, what we are following right now currently in India, in most of the countries for that matter, not only India, is the WHO laid down standards for the growth monitoring. It is called as a WHO Child Growth Standards 2006. In 2006, WHO declared certain parameters which should be used as a tools to monitor the child growth, overall child growth, and it is called as WHO Child Growth Standards year 2006. So I request all of you to follow the same standards, same pattern in determining the growth and the development of the child. Now, what about the growth charts used in India? That is the common question which is asked, because many people think the WHO charts are for the Europeans and the Western country where the height and body structure itself is so different genetically with their DNA pattern. And genetically, we Indians are more on a dwarfer side, as well as weight wise also we carry the less weight compared to those people. So growth charts used in India still today, we are following the pattern and the charts which are published by the WHO in 2006. That is the standard parameter. Though there are many charts, I don't want you to get confused with that. Just follow the pattern which government of India is following. The charts, I'm going to show you few charts just now. Just see them carefully. Look into the details of these charts also carefully. If it is possible, you can even print out these charts also for your studies, because even in your practicals also we keep the growth chart for your identification and making some kind of interpretations also. This will continue even in your pediatrics in the final year, again same chart is used. So now I'm going to show you the charts here. Yes, so the first chart here. This is what this chart is showing. Care during the illness, height and weight. Here you have seen. What you are seeing here is the weight in kilograms, age in terms of months and the year. Age in terms of months and the years, weight in terms of the kilogram. So this is till what age? You will find this is from 0 to 36 months. That means for 3 years, from birth till the age of 3 years, this is a growth monitoring chart called as a growth chart. What you can see here are the different indicators. Which are those indicators? First is a normal, which is a green zone. You can see the green zone, which is a normal growth pattern of the child. Next to that is grade 1, it's written. Remember, what is this grade 1? Grade 1 of malnutrition. Then comes grade 2, that is grade 2 of malnutrition. Then grade 3, that is grade 3 of malnutrition. Grade 4 of malnutrition. So these are the various grades of malnutrition, and you must remember, just see height and this weight and the age proportion. Where child is normal, where child becomes malnourished. If he is malnourished, we don't use the term just malnourishment. We have to always put the grade. Grade 1 malnourishment is a different management. Grade 4 malnourishment is a different management. You must know the child is in which status of malnutrition. Grade 1, 2, 3, or 4. So read this chart very carefully. Apart from this, you have found something else very interesting. What is it? There is something called in the corner, care during the illness. They have shown a child who is lying down, sick, suffering from fever, diarrhea, or acute respiratory infection. So all the common infections which child suffer from are mentioned in this chart, and you have to write on which month. For example, third month. So at the third month, you have to make your remarks what kind of abnormal things you have found in this child. So all this interpretation you are going to do on this chart. So even at the age of 3, if child goes to a pediatrician for some medical intervention, the doctor knows what has happened to the child in last 3 years. His medical history is also clearly seen on the growth chart. Remember, that is the biggest advantage. So I just request you to clearly read this chart carefully, understand it. It will be in your exams for your interpretation. Now I'm going to show you the next chart. Now, which are these charts? There are two charts. One chart is for the boys from age 2 to 20 years, stature for age, weight for age percentage. So these are the percentage charts. That is for stature for the age and the weight for the age. Both are drawn on one chart only. This is for the boys created by the CDC. Then again, the second chart is created again by the CDC. This is for the girls from age 2 to 20 years. Stature for the age and weight for the age percentage. So remember, you have to clear cut read these charts, see how the growth and development happens, at what age the growth and development stops. You can just see here after certain point, which I can see clearly after 15 and 16 age, there is a static stage as far as the height gain is concerned. You can just say somewhere it is almost going parallel. As far as the weight gain, it is the gain is there. Weight gain is steadily the gain in the weight. But height, you can see the some static, it almost comes to the inner stage, the static stage. Then comes the male chart. You will find here in progress. what it is showing. Don't minimize the zoom.
No, I'm not doing that.
Then why?
That is only why.
Huh? That is what why that
Against
message
his
is.
friend.
So that message came here. Don't minimize. That has come like that. Now I continue. Sorry for the disruption. Now you can see the other chart. That is the fourth chart. What you can see here, a child age 1, 2, 3, 4, 5. This is what it's showing, those bars. So you can see the steady development. Can you see that? Steady development of the child in terms of the height and weight from age of 1, 2, 3, 4, 5. This is the standard. That is a peculiar how it should be in case of any girl or in case of any boy under 5 years of age. So we'll go to the next slide now. Is use of the growth chart. Here it's very nicely it has been described, which I would like to highlight. I have seen you 4 charts. If you see the growth charts, I have only shown you 4, but there are more than 50 such charts which are there in the records. And you have to, each scientist or a doctor uses as per their requirement. I have shown you the most common one which are used. Okay. So what are the uses of the growth chart? How it is used? First and the foremost, which I have already mentioned, is the growth monitoring. That is number 1. Number 2, it is a diagnostic tool. You may ask why it is a diagnostic tool. When child is suffering from, say, diarrhea, we are doing the blood testing, we are doing stool examination, we are doing other investigation, we are using so many diagnostic tools. But if you take the growth chart, immediately you are going to see so many things on the growth chart itself, some abnormalities happening. So growth chart is used as a diagnostic tool apart from the laboratory investigation. Remember this. Then for the planning and the policy making, how it comes into the picture. For example, not an individual child. If I am studying 1,000, 10,000 or 100 growth charts of group of children, the moment I'm reading those growth charts, I get an overall view that is called as a bird's eye view of what is happening. And it gives me the actually blueprint on which we are going to do the planning and further actions for the child development and the child care. So this is called as a planning and policy making. Fourth, it's educational tool. Why it is educational tool? For example, right now I'm teaching you. I'm teaching you about the growth and the monitoring, and I'm using those growth charts as an educational tool. You are using it, it's an educational tool. I'm showing you certain things on that growth chart just now, which I did. So I have used this as an educational tool or educational medium. Then comes tool for action. What is a tool for action? As I said, if I say take 100, 10 or 1,000 growth charts, immediately I come to know what is happening about the health of children in the community, in that particular group, at that particular time, in that particular province. I'm steadily taking the proper action. So it is a proper tool for the action. Then comes the evaluation. What is evaluation? Evaluation is you have to make some interpretation, judgment. You have these interpretations are also very important. So this is called as an evaluation tool for teaching, which I have already told you. We are using this as a tool for teaching. We are using this tool for teaching for the undergraduate medical students, postgraduate medical students, for nursing students, for the social workers. In fact, we are teaching even the Anganwadi workers who is just a 10th or 12th pass. She is not even graduate. She is also taught how to maintain the growth chart because Anganwadi, all the children are coming in this particular age group. So she is also trained for maintaining the growth chart. All the Anganwadi teachers under ICDS project all over India. So this is a tool for teaching. Okay. So I have given you the now 7 ways how the chart is used for the various purposes in our day-to-day life. Now we'll come to the alternative methods of growth monitoring. Just now we spoke about the growth charts, various charts, how interpretation is done, what is the use of the growth chart, then what are the other ways? For example, say nothing is available, what you will do? Alternative methods of the monitoring. Alternative methods of the monitoring, just now I told you, that is one way milestones, whether child is picking mental milestones, mental development, speaking, talking, walking, laughing, playing, is mischievous, alert, agile. So all these are milestones. These are the alternative methods of growth monitoring. And what else? Social behavior. Is child cranky? Is child isolated? Is child happy? Is he okay with group, with his colleague, with his teacher, with his family members? So this is a psychosocial development of a child. These are all milestones. Child is speaking, child is talking, child is laughing, child is playing with his friends, his little ones, his age group people. He is respecting the elders, or he's all the time fighting, or all the time he's dull, numb, isolated. So all these are various milestones. Remember this. We call this as a alternative methods of the growth development of the child. Then what about 5 years are now over? Then child goes where after 5, 6 years goes to the school. So care of the children in the school, that is also one of the very essential part. So what happens in the school? Taking care of one growth chart and doing interpretation is very easy for me, which I can do or any medical person can do. But when child goes to the school, what is the main thing happening here? Large number. In a school, in one class, there may be more than 50 students. In the entire school, there may be 1,000 students. So monitoring all the children and taking care of them is not so easy. So what we have to do, large number of school children, we have to monitor their development. Even in the schools, you must find in many schools right now in India. When they take the admission, the teacher is taking height and weight. It's written, the health card is maintained. Health card of all the children in the school are maintained. Continuously, every year they go to the next class, height and weight maintained. Their immunization schedule is written. Their health problems are written. The medical intervention is written. Their referral to other hospitals is also written. So health card of each child is maintained in the school. Though school is not supposed to interfere into the many procedures, till school health gives the basic information of the child's health condition and they contact the parents. So parents are supposed to take the decision in this matter. So that is one. Secondly, the mortality and the morbidity. What is the mortality and morbidity? It's very easy for us. We feel when small child is there, medical people will know what is happening. But even in the school health program, maintaining the register of child mortality and morbidity, that is a sickness among the children, is very, very important. I told you just now, we are keeping the school health card, which is for each student, and it is maintained for long time. Child comes in the first standard, he goes out after 10th standard. So it is supposedly you have to maintain it for 10 years, the full educational period of the child, primary school children, secondary school children. We do monitoring of the growth and development. I told you height and weight of the child every year. Then they do the dental checkup, they do the eye checkup, they do the ENT checkup. Sometimes in some of the schools, they do the hemoglobin testing also if it is required. They have full history of even vaccination schedule. Then how you are going to carry out this school health program? The accessibility. Accessibility is one of the very important aspect of the school health program. What do you mean by accessibility? See, for example, 50 students are there in class 5th standard, class A. If I am outside person, for me to stress 50 children, go to their house, find out their health status is very difficult. But all the children are under one roof at a time in the school. That is the biggest advantage. School health program has a huge advantage that children come on their own to the school for the education purpose. So when they are coming for education purpose, also they are accessible to us for the healthcare. That is what the term accessibility means. They are coming for education, but we are using their presence for health monitoring also, growth monitoring. So that is called as a accessibility. Prevention in childhood of health